It's Lindsay Smith-Rogers, producer of Public Health on Call. As 2025 winds down, we want to say thank you for listening, contributing, and sticking with us through another year of massive change and breakthroughs in public health. This season, we've explored how uncertainty can also mean opportunity and how science, policy, and community continue to shape the world we live in. We've also launched a brand new Instagram account at Public Health Pod, where you'll find highlights, quotes, and behind-the-scenes moments, as well as ways to tell us about what topics you want to hear next. You can also send us your questions and voice memos anytime at publichealthquestion@jhu.edu. We're taking a short break for the holidays, and then we'll be back on January 5th with Season 13 of the show. Until then, thank you for being part of this growing community. Stay curious, stay connected, and we'll see you in the new year. And now, on to today's episode.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers, and today we are talking about the fastest growing sport in the United States, pickleball. And as fast as pickleball grows, injuries pile up even faster. Dr. Eric Bowman, a sports medicine surgeon and researcher at Vanderbilt University, talks to Stephanie Desmon about orthopedic and eye injuries, how older people may be more at risk, and how to avoid getting injured on the court. Let's listen. Eric Bowman, thanks so much for joining me.
Morning. Good to meet you, Stephanie.
So today we're going to talk about pickleball, which is like the fastest growing sport in the United States. People love it or hate it, depending on how close they live to the courts. You have studied injuries with pickleball, but I'm wondering if you could start with why we're hearing so much about it.
It's interesting. It is the fastest growing sport in America. If you look at the numbers, about 36.5 million participants last year. One of the things is that it's really increasing in popularity among our older population. And so as you're seeing racket sports being pretty steady overall as far as tennis, things like that, pickleball has really gotten especially our older population active, which I think is great. I love seeing people be active at all ages. Pickleball has really ignited an interest in physical activity, especially in that population. So from the social aspects to the physical aspects, it's a great sport that we've loved to see people get active in.
So full disclosure, I'm in my 50s, but I also have become an avid pickleball player in the last year. We have a saying on the court, which is, no ball is worth the fall. And so I wanted to talk to you about the falls. What are you seeing in terms of injuries?
Yeah, so in the study that we did, it was a single institution, and it was over about a 5-year period, 2017 to 2022. And what we looked at were the different injuries that came into our system, so a pretty large health system. And we did see a dramatic increase in injuries over that time. Clinically, I'm a sports medicine surgeon at Vanderbilt, and what I see are soft tissue injuries, osteoarthritis, flares, and unfortunately, even fractures.
My understanding is that there's been a 3-fold in the number of players and a 7-fold increase in the number of injuries. So how do you explain that?
Yeah, that's a great point. So over the study period, we saw about a 7-fold increase in injuries, and it outpaced what you would expect based on just the number of people playing. The thing that we did see was the average age of injury was actually around 62 or so over 60. So I think what you're seeing is an at-risk population that's becoming more active. This sport depends on athletic movements, and it carries associated risks with that. Unfortunately, a lot of people just jump in. They don't really take much consideration for form, technique, and the types of movements that are going to be necessary to participate in the sport. Things like balance, coordination, strength. That's not on the top of their mind when they're saying, hey, let's go, with my friends and play pickleball. So, these are major factors in safely participating in a sport and can predispose an individual to injury if they're not addressed.
So I also noticed that the biggest rise in the number of players comes at a younger age, like 25 to 34. Are they not getting injured as much, and it's really the older people who are getting injured more?
What we saw in our study is that in the younger population, you do see more of the soft tissue injuries. So you're going to think about things like rotator cuff tendonitis, and you're going to think about things like calf strains and back strains. And we did see a dramatic shift as you went over the 60s age mark. You saw more fractures. And so I think that part of that is, as I mentioned, as we age, our coordination becomes less good, or our strength diminishes. And there's a lot of side to side kind of lateral movements and starting and stopping, which, like I said, that at-risk population is a little bit more susceptible to. But you are seeing the soft tissue injuries at younger ages, and then a dramatic shift to the fractures over 60.
It's funny because you said, people should really be checked out by the doctor, make sure they're okay to play. I mean, to me, the game feels like I'm standing on a ping pong table, right? Like it's just ping pong essentially, but like with a big paddle and no table. And so it feels to me like it didn't occur to me when I started that it was going to be as athletic a sport as I thought it was. And I imagine that's kind of how people approach it.
Yeah, and I think you have to take things into account, like the surface that you're playing on, what the conditions, is it wet, and even overall medical. Is it hot? Are you safe to participate from a medical standpoint? We do see, unfortunately, cardiovascular events and other injuries that, maybe need to use safety equipment, eye injuries, and things like that. So I think there's a lot of factors that come into it. I think you're absolutely right on that.
I was going to ask you actually about eye injuries. I understand that that's become a pretty big issue. What are you seeing, and how can we prevent these?
Yeah, so like in some sports, you can wear eye protection, which I think is probably a reasonable thing to do. And most of the injuries to the eyes are direct contact injuries. They're not from falls, but they can be pretty serious and actually life impacting as far as vision. There was a recent study that came out in JAMA that looked at these specifically, and so some more detailed information there. But that's certainly another aspect of this that you need to think about.
I dragged my 21-year-old onto the pickleball court over Thanksgiving, and I was his partner, and yet somehow I hit him in the eye with the ball. So he's okay. But I mean, that's also, you've got people there who don't play, we're not professionals. Is that also part of it? I mean, you're not used to, I get hit in my fingers every single time I play, at least once. And so I'm sure that I'm like creating some long-term problems with my fingers. I mean, is that true? Is that, an issue?
Again, you got to kind of weigh the balances of not being active and not doing things. And yeah, there are going to be some inherent risks. I think that the severity of the injury would certainly, and kind of your risk factors for that may sway you one way of participating or not participating. But I think personally, I love participating in sports, and I accept that there are going to be some sprains and strains and things along the way. So I think that's just part of being active and hopefully doing what you can as long as you can.
I also will say that besides the physical activity, personally, it's like my dopamine rush of the weekend is the hour I get to play pickleball with my neighbors. We're joking, we're laughing, we're, really connecting with people. Is that another one of the things that people really like about the sport?
Yeah, absolutely. You mentioned that the dopamine rush. I think that is a real thing, and we talk about like a runner's high. I think it's very similar. It's this, you get the endorphins flowing, and it helps you feel better. And you just feel healthier. In addition to just the social aspects of it, I think that's a real concept there.
Yeah, I've lived in my house for 15 years and barely knew any of my neighbors, and now I know a whole bunch of them. And we play all year round outside. Is there anything people need to think about if they're playing in conditions like last week they had to cancel because there was ice on the court?
That's a good point. I think any sport where where the surface, you really have to think about it. If it's wet, we should be cautious. Obviously, if it's icy, you need to be aware. You have to have good supportive shoes that have good tread on them. So some of my pickleball players that have had like an ankle sprain, I'm probably going to recommend that they wear a brace when they go out and play, because it can take months to really get that strength and balance back in the ankle. So I do think it is reasonable to take the conditions into consideration and take the appropriate safety precautions there.
How can we increase the awareness of the risks?
That's a great point because most people don't come to me and say, hey, can I participate in pickleball? Usually it's after the fact, after they've already had an injury. The things that I kind of recommend, I think if you are looking to get started in a new sport, I think first you talk to your primary doctor and you say, hey, am I medically optimized to participate in this sport? Cardiovascular wise, am I at risk? Do I have osteoporosis or other things that may put me at risk for fracture? And then physically, I think you need to look at yourself and say, am I physically optimized? Do I have limitations in range of motion or strength? Do I have balance and coordination issues? You can get a movement assessment. You can see a therapist or a trainer, and they can look at you as you do activities and say, it looks like you probably need to work on these things before you jump in. I do encourage that folks, if they're starting out and they're not used to playing a sport like this, that they get an instructor or join a clinic where they can learn about the sport, they can learn about proper form, drills, and then to help them safely ease into playing. We kind of talked about safety gear and eyewear and bracing for knees, ankles, wrists as they're necessary. And then I think it's important I always emphasize rest. So rest and recovery. Don't play through pain, of course. Listen to your body. There's nothing to gain if you're out there playing injured and you're just going to either hurt yourself worse or hurt something else. And when injuries do occur, seek medical care promptly so that we can start the most effective treatment. But hopefully we can help you be as active as long as you can.
Do you see pickleball continuing to grow in this exponential way?
Yeah, you wonder, is there going to be a threshold critical mass? I think that, we're not seeing that. I would say that it'll probably continue to grow. At some point, I may kind of reach a little bit of a slowdown, but my kids play it and, they're, elementary school. So I don't see it dying anytime soon. I expect that it'll continue to increase in popularity. And with that, we should kind of be ready to appropriately counsel and take care of the patients as they do participate.
Eric Bowman, thanks so much for joining me.
Yeah, thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.